Yay! Welcome and bienvenido to another live session with Dr. Jeff. I'm waiting for Dr. Jeff. Give me 1 second. Let me add him here to the live. There he
Hey, there she is.
Thank you,
How are
Doctor.
you?
Thank you for the patience.
Oh, that's okay. No problem.
Thank you. I know you had a long day today.
Yeah.
Uh, and we have some people here. Well, we're with Dr. Jeff, and I have some questions that already the patients asked through the
Okay.
Instagram. Naomi Rose, how much weight do you recommend your patients to lose before coming in for a lipo and BBL?
Well, it depends, right? If they weigh 140 pounds, probably not a lot. If they weigh 270, probably a bunch of weight. So send us your numbers, send us your height and weight. We can look at the BMI and calculate that. But it's different for everybody. And a lot of patients don't necessarily need to lose weight beforehand. But I would say that almost every patient would benefit by losing 10% of body weight after surgery for the next 6 months. But beforehand, without knowing, without seeing photos or knowing, what your weight is or your height is, there's no way that I can say, that you need to lose any weight at all.
Doctor, only Spanish fly. I'm so excited. I can't wait. She's
Oh,
having
good.
surgery with you.
Oh, good. Me too.
Di Sotelo, how long I'll have to take off the tape from under my breast?
How long? So you just leave them on until they fall off. Typically at about a week or so. If they get dirty or that sort of thing, you can peel them off. You can put new ones on. But at about a week, things are sealing over, so it's not a real concern. But if they're not, goopy or dirty or messy, you just leave them on because underneath the incisions are healing nicely beneath that. So we don't want to disrupt the healing cells by pulling those off, right? And when you do take them off, you can take them off very gently when you do because we don't want to disrupt those cells that are healing together.
And Di Sotelo is asking, what tape do you recommend after?
Oh, I recommend fadeaway silicone sheeting. All right. And there's another product out now, which is a also by Fadeaway. It's a gel. And those products I use starting 2 weeks after surgery. So not right away, of course, but 2 weeks after surgery, provided that everything is nicely healed or healing. Sometimes there are open areas because stitches want to spit, or for whatever reason, there may be a small open area which is going to heal. But what we do is we avoid those areas with the tape or the silicone or vitamin E, white cream. But as far as tape goes, I like the silicone sheeting tape made by Fadeaway, which is a great product. But wait 2 full weeks before you use that.
So yeah, the fade away, you can also get it on Amazon if you
You can just
want.
go to Amazon and go to Fadeaway silicone tape. You'll find it right there.
Brigida Lumara, my surgery is next Friday with Dr. Jeff.
All
Brigida,
right. I'm
Brigida
looking forward
Lumara.
to it. I'm
Um,
looking forward to it.
only one Spanish fly. I'm doing my surgery. Oh, she booked today, BBL. I'm very excited. Okay,
All
everyone is.
right.
I have a black. Okay, I have this hotel. I have a black spot on my tummy top where the incision is. Is it normal? Almost 2 weeks post-op.
Well, it might be. It depends. It could be a little bit of bruising.
Yeah.
So we should take a look, send a photo. I don't know.
Hotel, send me a picture, please. I think you have
Yeah.
my number because I think we spoke before. So please send me the information or give me a call or send me a direct message. Okay, so we can schedule like a conversation with Dr. Jeff. I'm very excited. Only Spanish fly. Okay, I have another question here. Hold on. What type? Okay, the type. I would like a breast augmentation, but why do some people recommend breast lift?
Okay, that's a good question. Well, we recommend it because they need it, right? So if the breast is hanging or drooping or sitting below the level of the fold underneath the breast, or the breast is sitting on the chest wall, you probably need a lift procedure. Okay, if you need a lift and you don't do it and you only do the augmentation, you're gonna have a breast that falls over the implant. We call it a waterfall deformity. Okay, so the breast implant will only go down to the fold, right? So it won't go below that, right? The fold is keeping it superiorly above it. But if the breast hangs over it, that's not what we want to, that's not the look that we're going for. And the lift actually raises the breast onto the breast mound so that sits nicely centered. over the implants? That's a great question, but there's real specific guidelines in the decision-making process as to who needs a lift and who doesn't. If you send us photos from the front and from the side, we could easily make a determination in most cases and have a conversation with you about that. That's a great question. I think we lost your volume.
Sorry. I just paid my surgery in full. I'm so ready. Just scared I don't wake up. And this is from Nani DVT.
All right. Well, I promise you won't wake up during the procedure. All right, but I promise you will wake up right afterwards. So we've never had, my desk here, we've never had an issue with patients waking up. I've never had an anesthesia issue in my 26 years in practice. So it's just not even a concern. If you were my relative, I would tell you it's not even a concern. But you are scared, and I tell you also, if you weren't, I would be. So it's totally normal. I wouldn't worry about it, but it is very, very safe.
Summer Rain 513. Please send me your name and your phone number so I can definitely set up a video call with Dr. Jeff if you need it, okay? One more question from Sotelo 17. One more question, LOL. When do breast implants start dropping? Mine are still really high up.
So sometimes they drop very early on. Sometimes they could take even 3 or 4 months. Sometimes I'll see it in a matter of weeks or 6 weeks, but sometimes it could take 3 or 4 months. So if they're a little bit high, the swelling should be resolving. You should be wearing the strap that goes across. I assume this is for an augmentation patient. And then you should be massaging the implants, massaging the breast as well in each of the 4 quadrants to help, lower that implant. Good question.
Very good question. And also, if you want to put how many days post-op or weeks post-op are you? Maybe it also question. Okay, but V Sandra 02. I need a touch-up, BBL, and lipo 360.
Sure.
What is the time needed to wait to do it again?
For me, usually 6 months. Because you're going to lose about 30% of the fat. It's resorbed. It's a normal part of the process. And for me, I think that we see the result itself at about 6 months. So whatever you have at 6 months, you're going to keep pretty much. So therefore, that's the time to do it. But if you were to have the BBL today and then come back a month from now, we wouldn't really know at that point how much is going to remain. And if we go in again at that point in time, we might do too much. So we're not really at a point where we're ready to go ahead with the next procedure. So for me, for BBL, I would give it 6 months to see where the final result's going to be, and then we can add more to a second round, that sort of thing. Good question.
Very good question. Thank you. Today we have a very participative community. Now the DBT. After the BBL, when do we take the blood clot shots? We supposed to take, I guess, like how many we supposed to take, how many days we need that shot.
Right, so we use Lovenox, and typically we start the day after surgery, and usually it's about 5 days. And that's usually sufficient. If we combine a tummy tuck with a BBL, we might do 7 days. But basically, it's about 5 days, and we start the day after surgery. And you've also received that shot intravenously in the operating room during surgery.
Yeah, when I did my surgery, I just got 3.
Mm-hmm.
So.
I think we
Oh,
lost your volume.
yeah, I got my implants on March 31. She's asking for the implants that are a little high.
March
Harley
31.
Quinn,
So what, 10 days ago?
doctor, remember this girl, Harley Quinn 430. I was booked with you for tomorrow. I want to be the first. I have been asking since last month, but was told today I won't be the first or second, so had to change. No, had to change, doctor. Harley Quinn,
That's
send me
interesting.
your name and your phone number, maybe. I mean,
Yeah, it doesn't make sense, but
oh,
okay.
because she has to travel. I don't know why.
Oh,
Why, why you change doctors?
doesn't
Well,
make sense.
yeah. When do you start plugging your belly button after your tummy tuck, and when do you start wearing a faja?
Well, the faja is worn 2 weeks later after the drains come out, and we don't typically plug the belly button. That could cause necrosis, that could cause damage to the soft tissue of the belly button. So I never put plugs in those. But after a couple of weeks, you start massaging those. You could use vitamin E. You can use your finger gently to massage the incisions, but there's no need to put a plug inside the belly button. But good question.
Okay,
Okay.
I got your number, Harley Quinn. Okay, so let's get one of these questions from. How long do I have to wait for a breast lift, augmentation, and a second round of lipo?
So typically 6 to 12 weeks is how
Oh,
long we wait after a regular procedure.
oh,
We wait
okay.
longer with the BBL to see if there's, how much resorption there is, but for a normal recovery with no issues afterwards, typically 6 to 12 weeks afterwards, we could begin with, any other procedure.
Oh, I see. Harley Quinn says that she couldn't wait too long because she can be so long without eating. So,
Ah,
and she couldn't be the first or the second one.
that's odd. So we have
And
an
she
early
said
date tomorrow, so we could have easily done that, but that's
there,
okay.
doc-
We'll figure it out.
she's at the clinic too right now, just in case. What's your
Oh,
name,
fair
Harley
enough.
Quinn? If you want, at least see Dr. Jeff before he goes. If my hemoglobin isn't high enough for a combo, Tommy Talk BBL, can I get my BBL still? Date May 12th. If my
Uh, if it's not enough for a combination,
Mhm.
we'd have to know what the hemoglobin
Can
is. We'd
I
have to
get my
take a couple
hemoglobin?
measures to elevate it.
Mhm. Can I get my BBL still?
Probably depends what the hemoglobin is, right? I don't have the numbers. So if we know what the number is, we could take some measures to increase the hemoglobin before the procedure is done.
Doctor, I wanna, I don't know, Yaya with attitude. That's my doctor. I wanna bring Yaya to the conversation. She just had, and sorry to put you in the spot, Yaya, but she's a patient of you. She's super happy. She had surgery like 6 days ago. She had a whole combo, breast lift and tummy tuck.
That's
She
great.
looks amazing. I just want her um, to say hi to you. Let me see if she can join the conversation quickly. Hold on. Ay, ay, ay. That's my dog. Yaya with attitude. Yeah. Yes, yes, yes. Let me invite her. Ay, ay, ay. Can you come to the conversation quickly, Jaja? She's adorable, by the way. Jaja, no, I don't know why. Maybe she took out the options to invite her
Oh, fair enough. We'll get her
because
next
I
time.
invited her the last time. So, oh, hey, here. Hold on, hold on. Oh, yes, invite. Let's see. At least you can see her. She loves you, and she spoke very high. Hey,
Hey, there she is. How are you doing?
Good. Hello.
Good to see you.
Nice to see you.
We can start a whole walk-on cameo series. I'm glad you're doing well. I'm glad you're pleased.
Thank you. Thank you.
talk to her. We did a live session with her while she was in the plane.
Yes.
Uh-huh.
Oh,
Well, it's good to see you.
very well. Very well. I feel so
How do
good.
you feel? How do you feel, Jaja?
I feel good. Resting.
Okay, okay. Any questions for the doctor?
Uh, you left me in good spirit. So
Oh, I'm glad to hear that. That's the goal.
everything's healing perfectly. Thank
Oh,
God.
Wonderful.
beautiful.
Yep.
Jaja, thank you for
Took off
joining.
took
Sorry
off
to
my tapes, all
hi.
the tapes off, so everything looks good.
Fantastic. Glad to hear that.
Still draining.
There you go.
Any,
My new best friends.
Absolutely.
anything you want to say to Jaja, doctor? And
No, I'm glad she's doing so well. It's great to see you again, and we'll see you soon.
Yeah, thank
Keep
you.
us posted. It'll be great progress.
I will definitely.
thank you, Jaja. Thank you. You're letting me put you in the spot all the time.
No,
Thank
it's okay. It's okay.
Good to see
you.
you.
Bye. Bye.
All right. Well, she's sweet.
She's super sweet. How high does your hemoglobin have to be for a combo procedure? And that's from Summer Rain.
Typically about 12.5 or so.
Okay. 12
Yeah,
point.
we did
Uh,
12.5 or so. Yeah, even over 13 is ideal, but even 12.5 is usually sufficient. And if we need to, we may use a cell saver in the event that somebody's hemoglobin is borderline, or we feel there's a little bit more, loss in the OR. We might add a cell saver to it, but otherwise, we like to do everything very safely. And if we're in the middle of a procedure, if we're doing a combination and we feel that there's a little bit more oozing or so, we might not do the second procedure. So we definitely want you to get the hemoglobin up. We could take iron pills. There are infusions. There are steak dinners. A number of different ways to bump that.
Doctor, just one last question before I let you go. Because no, they asked me this earlier in the live, and I didn't know the answer. So talking about cell saver, let's say the hemoglobin is like, someone has a hemoglobin is 11 and she has like a combo procedure. Can she use cell saver in that situation?
Well, we're not going to do a combo with somebody with 11, right? So we wouldn't even do the procedure. That's not even
Yeah.
possible. So we'd have to use a cell saver with a single. I mean, 11 is getting low because there's a little bit of blood loss with every procedure. Plus, we give a bunch of fluid. So fluid hemodilutes the blood. So you drop your blood count just by getting, an IV. So the combination during a procedure that could be a couple hours long or longer, depending on the procedure, we're not going to do any combination at 11. So that we want like 12.5, and we can get it up there, but it just takes, a little bit of time, a little bit of effort, but it's worth it, right? Safety's, the
Yeah.
main thing here. So it's definitely worth it. We're not going to operate, prematurely and jump right in.
Yeah. So for the people that is asking, cell saver is around $550, $500, $600. I don't remember right now.
Right. Something like that. Yeah.
Yeah, but okay. Thank you so much. I'm so excited. See you, Dr. Jeff, in June.
All
Uh,
right.
so it's summer is asking is 12.3 good for a combo procedure.
Probably with a cell saver.
Oh, okay,
Good.
beautiful. Okay, doctor. Well, thank you so much for your time.
Good
I
to
know you
see
have
you. Good to see all
a
you
lot.
guys, and we'll see you next time.
Beautiful. Thank you.
Thanks so much. All righty. All right. Bye-bye.